Hi, everybody. Thank you for joining us today. We'll go ahead and get started in a few minutes. But in the meantime, as we're waiting, we'd love to get a little poll about who's joining us today. So if you could go ahead and answer that. All right. Hi, everybody. Welcome to one of the last of our summer webinar series of the summer. My name is Lincoln Till. I'm the Senior Assistant Director for Orientation in the College Programming and Orientation Office. And today's webinar will be all about pre-health. You'll hear from representatives in the College Academic Advising Office and our careers in healthcare. They'll provide you a bunch of information about the requirements and what it looks like to pursue a career in the health field. And just a reminder, this will be recorded. So if you want to come back to it later, you can find it linked on our website or on YouTube within the next couple of days. Most of this webinar will be a presentation by the two of them, but there will be some time at the end for Q&A. So you'll see the little Q&A box on the bottom of your screen. If anything comes up while they're presenting, or you have any questions now immediately, feel free to drop them in that box, and we will do our best to answer as many of them as we possibly can. And with that, I will go ahead and pass it on over to Catherine.
All right. Thanks, Lincoln. Cool. Well, we'll go ahead and get started. So, welcome and thank you for attending the pre-health information session. This webinar is co-hosted by the College Academic Advising Office and Careers in Healthcare team from the Career Advancement Office. This webinar is intended to help you understand the general academic path that pre-health students take to complete the prerequisite requirements for graduate school applications, which would include medical school, as well as the overall scope of support and resources available for pre-health students. My name is Catherine McElravy, and I am the Senior Academic Advisor in the Advising Office. I'll help answer questions in the Q&A function during the presentation today, but we'll save some more involved questions for after the end of the presentation when we can go more in depth with some of the questions you all might be asking too. So for now, I will pass it over to Caroline Wilkie in Careers in Healthcare.
Hello, everyone. Welcome to the University of Chicago. I'm really excited to be working with all the first years and the transfer students throughout their journey to a healthcare career. As Catherine mentioned, my name is Caroline Wilkie. I'm the Director of Pre-Professional Programs in the Career Advancement Office, which means I oversee our pre-med and pre-health advising team. A caveat for this presentation, it is going to be primarily focused on pre-med. But we and our team serves every student who's interested in healthcare. So if you're considering dentistry or PA or pharmacy or any other clinical career or a non-clinical career in the healthcare sector, we are here for you and we have resources for you. But since the majority of our pre-health students are interested in attending medical school, the focus of today's webinar is going to be on that. Okay. All right, so we've already done our introductions, but I wanted to shout out two of my colleagues who also work with our pre-health students, who advise through all steps of the way, from incoming concerns to applying to medical school whenever that time is right for you. So I have two colleagues who work on my team, Elise Grunyson and Swapna Shah. They are not here, obviously, but they are excited to meet you and work with you as well. Okay, so our team provides a number of ways to support you on your journey to medicine, to healthcare. First and foremost, we do personalized advising. So the backbone of our work is talking with you one-on-one over email in 30-minute advising appointments, in events like this webinar, to give you that information that you need and to tailor the resources at the university more largely to whatever your goals are in your professional life and your interest in medicine. We also help students find internships and full-time roles. So we work with employers to find and create substantive internships through our Metcalf program. And then we help students find those experiences, apply, and be successful. If you're considering a gap year before you apply or before you attend medical school, we'll also help you with finding substantive, exciting full-time roles. We host a number of programs and cohorts that I'll talk about in a little bit later in the presentation to help with that career exploration, to help gain the skills that you need to be a competitive applicant, to help you figure out what it is that you want to do in this broad field. And then when you are ready to apply to medical school, we have a really robust support system for applicants. Whether you're a current student or an alum, you have access to our resources in the exact same way. So we work with applicants for 2 years, prepping their application and getting them through the interview cycle, really making sure that all the great experiences they've had at the university are coming through in their application. So like I said, from the beginning to deciding among medical school offers, we're here to help you every step of that way. Okay, as I mentioned, the cornerstone of what we do is chat with you. So you can schedule a 30-minute individualized one-on-one appointment with us whenever you like. We are here all summer. So whether it's today, tomorrow, over break, we are here to chat with you. So whenever that works for your schedule, whenever you want to, there are no required times to meet with us. I do recommend students meet with us twice a year at least, just to make sure that they're feeling good, that they're on track, that they that any of their questions that they might be lingering, things you might have heard on Reddit, can be answered in a timely manner, so that you can get where you want to be on the timeline that works for you with at least amount of stress as possible. So what we talk about in these appointments is career exploration. So if you're not sure medicine is right for you, or you want to think about what is the best fit for you career-wise, we can talk about that. We can give you some suggestions to really systematically explore and determine what is the path for you. We can certainly talk about the components of the application. So if you do decide medicine is your path, we're your resource for making sure that you're satisfying prerequisites, any GPA concerns you have, planning for and taking the MCAT, planning gap years if that is part of your path. Those are common questions we answer or conversations we have every day. As I mentioned, we're also your one-stop shop for finding substantive summer experiences and jobs. And we can talk about your application competitiveness. Like I said, that's a great thing in your, twice a year check-ins. How am I doing? How, what should I be devoting my time to? How am I looking so far? And then finally, really anything else. So whatever you have concerns or question about, don't hesitate to schedule one of those meetings with us. If you have a question that you feel could be answered over email, you're also welcome to just directly email. If we feel it's a little bit more complex or want to talk you through something, we'll just ask you to schedule an appointment. All right. So many of you have already met with us, and so you're familiar with the process. But if you haven't yet, you can schedule appointments on Handshake. You go to your main page, you go to the Career Center, you choose Advanced Degree Advising, and you'll see Pre-Med Advising, and that will show you all the availability that Elise, Swapna, and myself have. If you cannot find an appointment that works for you, you're always welcome to email us and say, hey, I would love to meet sometime this week. I'm available these days, and we'll work to fit you into our schedule. All right. So that's what we offer in terms of big picture, how we engage with students, and what conversations we're happy to have with you and how we're here to help. Now I'm going to shift a little bit and talk about what might be on your mind now, specifically concerns as someone starting the pre-med paths, or acclimating to the university. So these are going to be common questions that first years have or incoming students have. And hopefully this webinar will make you feel really comfortable and answer those basic questions so that you can hit the ground running once you're on campus. So first, because this is a joint presentation with our lovely colleagues in advising, we're going to talk about majors, right? So obviously your academic advisor is the person that's going to help you throughout your 4 years, figure out what you want to major in and how to complete those requirements. But our team can tell you, how do medical schools view majors? And so that's what I'm going to talk about right now. So a misconception among applicants is that medical schools have a preference for majors. The truth is they don't, and you can truly major in any of the majors that this university offers and have a wonderful, successful cycle. I like to tell applicants that medicine touches on every aspect of um, society and human experience. And so anything that this university is offering as a major is relevant to medicine. Certainly biology and neuroscience are really popular majors for our pre-med students. Most pre-med students, love biology, love the basic sciences. And if that's where your passions lie, for sure pursue that. But if you want to major in German studies or classics or Mang or biz econ, follow whatever your interests, wherever your interests are taking you. Double majoring is often a question we get too. And many students feel that double majoring will add to their profile, that it shows that they can handle the rigors of the curriculum, the fast pace of medical school. Medical schools really don't care about double majors. So if you are considering that, it's certainly a great idea if it's something that interests you. But when you're deciding whether or not you want to do the double major, whether or not, it being a positive to medical schools, it should not be a factor in that. Medical schools understand the rigor of UChicago and they understand the rigor of a quarter system, and they know that just majoring in one thing here will prepare you very well for the curriculum of medical school and the time and intellectual rigor that requires. Similarly, many students come with this concession that they must take the most advanced version of a prerequisite, or they have to take really advanced courses in their major. Those things are great, and if you want to do those, by all means, we would encourage you to. But again, just don't have medical school be a factor in that decision for you. So if you're deciding between honors and not, medical school should not be a factor in that. It should be other things that help you make that decision for you. This is not something you might be thinking about now, but similarly with the BS or the BA degrees, we have students do both and do great. So again, it's not that one is preferred or the other. Medical schools view this as kind of a value neutral thing. So if it is something you want to pursue, you can pursue one or the other based on your subjective interest, desires, motivations. Okay, so just as you're thinking, as you're exploring, as you're taking classes, as you are finding your passion, the best thing to think about when you're thinking about majors and minors and more is medical schools don't care. Follow your passion, do the thing that excites you, do the thing that you enjoy learning, do the thing that you're doing well in. And you can, like I said, be successful in the application cycle with any major at the university. Okay. So next we'll talk about prerequisite courses. So medical schools they're not all uniform in terms of what they require. Some medical schools don't have any prerequisite courses. They just say they want you to demonstrate competency in chemistry and biology, but they don't care how many you take or what courses you take. Other schools are very, very strict and they want to see a specific number of hours in each of these categories. And if you don't complete that, you cannot matriculate into their school. And there's legal reasons for that. So it varies widely. But this is our recommendation. So Careers in Healthcare periodically reviews all the medical school prerequisites and makes sure that we are giving you advice that will satisfy 99.9% of medical schools. So our recommendations are to complete 1 year with lab of general chemistry, organic chemistry, biology, physics, and English, which most of our students complete through the Hume sequence. We also recommend 1/4 of biochemistry and statistics. Most of our students take a biostats course in the biology department as part of their sequence, but for medical school, it can be any statistics course that the university offers. So as I mentioned, those will satisfy 99.9% of medical schools. Your academic advisor is well versed in these requirements and which sequences satisfy them. So, you can trust their advice about completing the pre-med prerequisites. We work closely every year and we give them any updates about any changes. So they're knowledgeable about this, and you can trust their guidance for sure on what sequence to do and when to do it. There are some things that you might want to think about given your particular situation that just to be aware of or potentially to bring to us, the pre-med team, the Careers in Healthcare at Career Advancement. And that is public school considerations. So the schools that tend to be strictest with requirements tend to be your public schools. And so we recommend that every student pay close attention to the requirements in the schools that are public that you are a resident of. So for example, our Texas schools require twice as much biology as every other school in the country. And so obviously if you're a resident of Texas, you want to satisfy those requirements. If you're a bio or neuroscience major, obviously you're going to organically, but if you're considering not majoring in that, it's something to think about. So everyone should check the policies of their state school that they're a resident of, just to make sure that they know those, and that they're on track, since most of those in-state schools have a preference for residents, and you want to make sure that you're eligible for those schools. So I use the example of Texas schools. If you're considering a non-bio major, for example, but in general, if you are not a science major, we recommend taking a couple of additional courses beyond this recommendation. So if you're going to major in English, like I said, you're going to have great success in the med school application cycle. There's no problem with majoring in English, but you might want to take maybe 2 additional bio classes just to make sure that you can show that competency and that you can make sure that you're, in line for any school, just to kind of conservatively make sure that you're going to satisfy those requirements. Even for schools that don't necessarily require those things, it can be nice to show a little bit of that, that scientific interest and competencies beyond just these prerequisites. And then finally, you might have questions about AP credit or credit by exam and how that impacts your completion of prerequisites. This is a little bit more complex of a topic, and it might be worth talking with us in addition to your academic advisor about this, because different schools have different policies about AP credit, and depending on the type of course you're using it for, there might be some considerations that you have to take into account and things that you have to add to your curriculum. So if you have AP credit and you're planning to use it to satisfy any of these requirements listed here, reach out to us just to confirm that that is not going to have any consequences or issues. It's really not a big deal, but we just want to make sure that you don't have any surprises when you are actually ready to apply. Okay, so um, like as I mentioned, your advisor knows these prerequisites, they know the curriculum. They are a good resource to making sure that you are on track of completing those. They see a lot of pre-med students. They know what is commonly done in terms of ordering your classes and making sure you're ready to have to apply when you want. But if you're thinking about, okay, well, who do I take this question to? Is this a question for academic advising, or is this a question for careers in healthcare or the pre-health team? Easy way to think about it is if the question is asking, what does UChicago require? So what will satisfy my major? Should I take this core class now? Will this transfer because I need it to transfer? Do I need it to transfer for my degree? Questions about what UChicago requires is a question for your academic advisor. If it is a question about medical schools and what they require, it's a question for us, right? So, for example, taking the example of whether something transfers, medical schools don't care whether or not it transfers. Every college course that you take in your lifetime is accounted for on the application, and a transcript from that university must be sent to schools regardless of whether it transferred or not. But obviously, if you want to use that credit to satisfy some part of your UChicago degree, you need to talk to your academic advisor about whether that will work. So easy way to think about it. Again, if it's about what UChicago requires for you to complete your degree, for you to complete your major, for you to complete the core, to graduate on time, to do study abroad, all those things, talk to your academic advisor. If it's about what medical schools need or require or want or prefer, bring that question to us. Okay, so grades. Obviously, all of you are going to have 4.0s your first quarter, but we have students who have a lot of stress around grades because medical school admissions is competitive. And if you ever go to a website for a medical school and they have on that website, here's the average GPA that our matriculating students have, you're going to see something kind of crazy high, like a 3.95 or something like that. That being said, our students are successful at GPAs that are lower than that. So one example I use is that if you look at Stanford Medical School, I think they post that their average science GPA is something like 3.95. The average science GPA for UChicago students accepted to Stanford from UChicago is around a 3.73, so lower than that. So we share this information and this data with students because we don't want you to come into or complete your time here at UChicago with this misconception that the GPA needs to be near perfect to be successful. We have students, with our median for accepted applicants is 3.6 for the science GPA. And we have students accepted with that and lower at really fantastic schools. So similarly, if you have a little bit of difficulty adjusting to college, and most people do, it's an exciting but can be stressful time as you're learning how to study differently for college courses and adapt to the rigors and the excitement of life in college. It can be sometimes a rough transition. Medical schools understand that. They understand that that's common for every student. And if you don't perform up to your standards first year, or you feel like you have room for improvement, that's not something to stress about. And that's not something that will ruin your chances. Similarly, one-off bumps in the road are not something to be a concern, right? So if you get a C in a class because it's really hard, that's okay. That's not going to keep you out of medical school. That's not going to keep you out of a good medical school. A couple of years ago, we had a panel of UChicago alums at Penn, and I think every one of them had one C on their transcript. Similarly, the W's or having to pass fail a class. This is not something that you should overly stress about. It only becomes a problem when it becomes a pattern. So give yourself a little grace if things happen. It's not a problem. We talked about this with some of the the considerations about majors and double majors and advanced classes. You don't have to take the most difficult curriculum. And it's a good idea too, if you know you're going to be super busy a quarter, make those concessions, make your life doesn't have to be at hard mode all the time. And then overall GPA versus science GPA. We tell our students and our applicants to focus on science GPA for the purposes of determining whether they're ready and their competitiveness, just because a science GPA is the one that medical schools focus a little bit more on. Most people's science GPA is, the same or a little bit lower than their overall, but that's the one that we want you kind of focusing on and thinking about in terms of, preparation and preparedness. Okay, so we're going to transition a little bit now from academic considerations to extracurriculars, and we're going to give you some suggestions for getting started with extracurricular experiences. You don't need to, as a first year, immediately join 10 clubs and get involved in research and pack your day. It is fine, and it's encouraged to use that first 1 or 2 quarters to acclimate, to make friends, to figure out how to study, and you don't have to immediately become super pre-med person with all of these activities. But we'll go over what the general types are that we encourage our pre-med students to explore, as well as some things to focus on that first year, maybe that first summer in particular. So the most important thing is going to be that clinical experience or patient exposure, right? So that can involve clinical volunteering, so volunteering at a hospital, volunteering at a hospice center, volunteering at a free clinic. That could be clinical research. So you might get involved in a project on campus where you interact with patients, helping enroll them in studies or conduct the studies. And then finally, more of straight paid clinical experiences, working as an EMT. All of those are great experiences. There's not really a hierarchy with them. A lot of applicants feel that paid clinical or things like a medical assistant or EMT are higher value. That is not the case. There are some really, really high value volunteer experiences you can do. There's really, really high value research experiences that involve patients. So what you want to ask yourself as you're exploring these options is, do I get to meaningfully interact with people? And if your answer to that is yes, it's a good experience, regardless of what type it is. So for example, working as a hospice volunteer, meeting with people and sitting with them and talking with them during end of life, that's a very valuable experience to tell you and to tell medical school admissions committees that you can handle the hard parts of this job, that you really like people, even in really difficult situations. And so that is just as valuable, if not more valuable than, taking someone's blood for sure. So think about your clinical experiences from that perspective, from quality rather than type. And another question we commonly get is how many hours do I need? It really depends on the applicant. Some applicants are very patient focused and they have a lot more. Others are more research focused. There's not a right way to be an applicant. But generally speaking, we recommend most of your time as a pre-med, you should be getting 2 to 4 hours per week of consistent, good clinical exposure. Not every quarter or all the time. It doesn't have to be that consistent, but you're looking for something that's consistent and meaningful. In terms of diverse, if you want to jump around to different clinical experiences, that's totally fine. So maybe you volunteer at a hospital for a year and you really enjoy that experience, but you feel like you want to change and you want to maybe do a smaller clinic or you want to do that hospice volunteering. You can jump around as long as you have consistent interaction with patients. Okay. Before we go to treks, the other big things that our pre-med students are doing is service and research, right? Most of our students do some type of research, in part because There's so many great opportunities to research. Faculty really enjoy working with students and are eager to have them participate. So if you're interested in research, most of our pre-med students will start that maybe like winter, spring quarter or in the summer of their first year. So again, you don't need to, start reaching out to people now to get involved in research. You can take your time, explore a little bit, and start a project in the summer. But in terms of research, any type is great for medical schools. Anything that touches on some aspects of human health or healthcare or science is going to be wonderful. So whether you want to be in a basic science lab pipetting all day, or you want to be in a community health center interviewing patients about their access to treatment, any of those things and anything in between, policy research, econ research in the healthcare sector, all of that's going to be great. So again, pursue the things that are interesting to you. And if you really love research, you can do a lot of it. If you don't love it as much, you can do other things. And then service, I'll talk about that briefly before we move on to some of our cohort programs. Service is going to be important for pretty much all medical schools. The reason that they like service is because they want people who have a service orientation, who enjoy helping other people. Medicine is a service profession. They also want to make sure that you understand the needs of our more vulnerable populations, right? Because they want to make sure that you are coming as a physician and you understand the variety of people that you'll be working with, that you'll be serving, and their different needs, especially our most vulnerable patient populations. So that's why service is valuable. There's so many great opportunities to get involved in service at the university. We have a ton of RSOs that have a service function. We will be doing a mixer that I'll mention in a bit, those details for. But RSOs are a great way to get involved in the Southside community and to give back. But there's a lot of wonderful ways that you could do that. All right, so I'm going to talk briefly about our treks. Hopefully some of you will be joining me on the CEW in 2 weeks in Chicago. If not, you're going to have plenty of opportunities to do a similar type of experience. Treks are winter and spring break, as well as some summer experiences for our current students. And I'll be leading a winter trek to Boston. And so these are short experiences that are wonderful ways to network with employers, to meet really, really interesting alumni physicians. Boston has a ton of U Chicago and Pritzker alums that we'll be connecting with, as well as med students. We all always tour a medical school on one of these treks, but they're just a great way to meet other pre-med students, to maybe get exposure to some specialties or fields or research that you weren't aware of, and to have fun in a new city. So, like I said, winter, Boston, the application for the treks opens tomorrow. So you can apply tomorrow morning if you want. Okay. I'll also highlight our Beyond the Clinic. This application is open and it will close on October 15th. So Beyond the Clinic is a one-year program that helps you systematically kind of explore roles for physicians or healthcare practitioners beyond directly treating patients. So we have people come and speak about their roles in public health and global health, healthcare business and innovation, devices, startups, and everything in between. So if you want to see how cool the job is of a physician and how many ways that you can impact the field of health and healthcare beyond just that really important direct patient interaction, Beyond the Clinic is a great way to get exposure to that, and to meet people doing really cool things in those sectors. Clinical Service Fellows is also a one-year cohort where we help you find a meaningful volunteer experience in a hospital, clinical, or clinic or community organization. Again, this is open and the application will close on October 15th. So you can find, and these are all posted on Handshake. So if you want to go on your Handshake and search for these experiences, like I said, they're all open and available except the treks, which will be open tomorrow. Okay. So that gives you an overview of kind of academic concerns and questions you might have, a little bit of contextualization as you start to think about, what am I going to do extracurricularly to explore this field, to build my application. Um, but I'll give you kind of 5 things to do in the next month, as you are, missing your friends who have already started college, and having that FOMO. These are some things to occupy that time and get you excited about your pre-med journey at UChicago. So first is attend our boot camp. I will share the QR code for the boot camp registration, but again, it's on Handshake already. So the boot camp is specifically for the class of 2030. It's a half-day event on the first Saturday of the fall quarter, and it's a crash course of everything you need to know as a first year. So a lot of the stuff we talked about today, but with more depth. We'll have some workshops. You'll leave with some takeaways. One thing that we do that everyone loves is we share successful applications during this. We'll also end with a fourth year panel. So fourth year pre-med students will share their advice as you get started. Um, Easy thing to do is sign up for the CIH list host. Again, we'll have the QR code for that. But our list host or our newsletter is how we communicate with students about all the amazing jobs and internships and summer experiences, as well as events that are happening, and important things you need to know in the application cycle. So this goes out once a week. It's not currently being distributed as we are on break, but if you sign up now, you'll receive all of those, and you will be in the loop. Great time to review your resume now, as I said, as all your friends have already left. On our website, we have a great resume template. You can just download that and start entering your experiences from high school into that. Once you get onto campus, you are going to not want to have to spend time fiddling with your resume and getting that reviewed. You'll want to have that ready to go so you can apply to RSOs, so you can apply to positions, so you can send it to faculty that you want to work with. You'll do yourself a big favor by having that polished and ready to go before you get on campus. So download that template, send it to your advisor to review if you haven't already, and have that ready to go once school starts. The next event that I'll encourage you to attend is going to be our mixer, our welcome mixer. So this is an event for all students, but it's particularly useful for first years. And it's a great place to meet your RSOs. So we're going to have just the healthcare focused RSOs will be there with tables. And so you can see all the cool things that they're doing. Many of our RSOs have a strong community health focus, meaning they work directly with members of the community to identify specific health needs and work on implementing projects and programs to address those. So there are great experiences to help you understand the needs of the Southside community, to really get that like project-based experience, to do things that really do have an impact. So come meet them, learn about the work that they're doing. This is going to be on the second Monday of the fall quarter. It's a career fair type event. So you just drop by, talk to whom you want, have an appetizer, and head your way. All right. And then finally, apply for a cohort or track. Like I said, all the cohorts are already posted and ready for applications, and the Trek experience will be open tomorrow. So next, I'll let you register for these experiences if you want, to the boot camp in the welcome mixer to meet the RSOs. There's also going to be medical schools at the welcome mixer. So we typically have all of the Chicago area medical schools will send an admissions representative there just to talk to you about their school, answer any questions you might have, plus wonderful campus partners and other experiences. So it's a great event. All right. I think that is everything. Do we have questions?
Yes, we do. So I'll ask some questions and then we can just kind of, go back and forth, and there might be some I'll be able to answer. Of course, if anyone would like to submit any more questions, you are welcome to do so in our Q&A function. So a question that I'd like to start with. So, you mentioned that some students may get involved in some research on campus. What are the best resources for research opportunities during the school year?
Yeah, that's a great question. So we have a couple of ways to get involved in research. One is through like formal programs or essentially research internships that are advertised on Handshake. So, for example, the Caton Scholars Program, which our team runs, is a wonderful opportunity. Particularly, it's because it's focused on getting first and second years connected to UChicago researchers, PIs, and labs. And so those applications go live during the winter quarter, typically like mid-October. And students can apply to as many of them as they're interested in. So, if got like 16 labs, you can apply to all 16 if you wanted to. And that and similar ways are a great way to find research. But a lot of people find research by cold emailing faculty. And so we have advice about how to structure an email that you might send to a faculty member to inquire about whether you'd be able to contribute to their research. And we can certainly talk to you about like how to find faculty that might be of interest to you. So those are the two ways, either directly emailing faculty or applying to things that we advertise on Handshake. And if you're connected to our careers in healthcare newsletters, you're going to see all of those more formal research application opportunities. And like I said, if you're interested in potentially reaching out to people, schedule an appointment with your advisor. We can help you draft those emails and find people that might be good for you. And obviously that's why you want to have your resume ready, because that'll be part of that email. So yeah.
Great. And then there were some questions just with our launching of like a new writing requirement where we have the
Mhm.
maroon track versus the gray track. And the maroon track will have students take Writing 101 at some point in their first year. Would this class be able to count as that third kind of course within the English humanities requirement for medical schools?
Yes. Yes. So the English requirement causes some consternation because it is the most like subjective, if you will. But in our experience, anything in humanities has counted. Anything that has a substantive writing component, and certainly anything in the English. The other thing is for a class to count for a prerequisite, you must take it for a grade. And so since this new writing component meets both those requirements, we believe it will count for the English requirement for med schools.
Perfect. All right. We also had a question, and I can start with answering this too, of whether it's possible for pre-health students to participate in study abroad, and that there are a decent amount of classes that students end up having to take to meet some of the prerequisite coursework for medical schools later on, of how do we fit all this in within the timing of things. And really, a lot of it is just intentional planning early on with your academic advisor, to really talk through of like when might be a good time for you to take this specific sequence. Um, how might this either work with your major classes, or if you're majoring in something else, like what other requirements do you need to focus on there? So, starting with making a 4-year plan early on with your academic advisor can be really helpful with thinking through of like when there might be opportunities for study abroad. The Careers in Healthcare program has a really helpful website on like when you can, that kind of summarizes all of the pre-health requirements and sequences you might want to be on the lookout for. So I can drop that link in the chat in a little bit. Highly recommend bookmarking that. But anecdotally, I've had students in like a pre-health uh, track or goal, like go on study abroad, even like over the summer. I've also seen some students maybe go on study abroad in like autumn quarter of fourth year is like another example. So, yeah, so it is possible, but it requires some planning. Caroline, did you want to add anything to that?
No, that was very good.
Okay, great. Um, oh, also, there have been a couple questions about this. Could you say something? So it looks like on Handshake, when students were scanning the QR code, that registration is closed for the mixers, the
Oh,
welcome mixer, and it seems like that's the
okay. Well,
main
that
one.
is not supposed to be so. So I will fix that as soon as we log off, and then you should be able to register for that. I apologize.
Okay,
Yeah.
great. Perfect. Okay. Let's see, just looking at some others. Do you also, could you provide an example, Caroline, of medical schools that have that like prerequisites where it's outside of like the 99.9% you mentioned earlier? Like
Yes.
where, yeah, there any example of that?
Yes. So it's mostly the Texas schools. So honestly, if you're not a Texas resident, you can kind of breathe a little bit more easily. But Indiana, for example, gave one of our student a little bit of trouble about the physiology course, not counting as a biology course, which doesn't make much sense to me. So eventually, this person was, I think, a math major, so they had just taken the 3/4 of bio, and this was one of them. So it was a bit of an issue. So that's kind of why they're fine. They're in medical school now, and we were able to resolve it. But just to make your life easier, as a math major, we would have liked him to take 2 additional bio classes just to prevent something like that from happening, but also to show that value or show that interest in biology. So it's not super common, but my advice is always on the more conservative variety. I don't want you to have an experience like that. So it might be a little bit more overkill than than maybe is warranted.
Great. And could you maybe say more about like what does a GPA range look like for students who get into any medical school from U
Mhm.
Chicago? Do you have maybe some of those numbers or like averages, ranges?
Yeah,
Possibly.
absolutely. So when we're advising, we consider a 3.4 science GPA to be a safe GPA. And by safe, I mean I wouldn't tell an applicant who feels really good about everything else that they need to delay to take additional science courses to work on it on completing that. So anything a 3.4 and above, with, like I said, a solid other parts of the application, we see students have success. Um, Seen students have success with like 3.2s to 3.4s quite often as well too. Because the thing that also about the science GPA is they when AMCAS, which is the primary application for medical schools, when they calculate it, and the other application services do this too, they do the GPA based on year. So, if you have an upward trend, but you're a little low, like that matters. So there's a lot of factors in, but generally a 3.4 is a good safe one. 3.2 to 3.4 is pretty good too. The only time that we recommend waiting or remediation is if the science GPA is below a 3.0.
Great. Thanks for answering that. Um, and then another question about the clinical service fellows. Um, Does this program help a student find a long-term service project, or is it more like exploring numerous different opportunities over the course of a year?
Great question. It's more of the former. So we help students find something that connects with their interests. So we start with fellows, but just having a conversation like, what do you think you might be interested in? Like, are you interested in pediatrics? And help them kind of look through their options and find something. And then we ask that they commit to that for a full year.
Okay.
Mhm.
Let's see. And then as like we've talked about like medical school and different ways to kind of set your application apart. What do maybe some of the top medical schools look for in candidates? Are there things that students may want to focus on or think about as they set themselves, on their path through Chicago, or what have maybe been like some success stories around that?
Yeah, that's a great question. So I always tell people that, top 20 schools are looking for, the best of the best, right? So um, there's not one size fits all because they're looking for the best community health person and the best immunology research person and the best, right? So what my recommendation for students coming in is the best thing that you can do to set yourself up for success is try to find what you're passionate about in the area of healthcare, right? And find substantive experiences to really show that you have a deep understanding of this area, of the problems, of the promise, and that you have a vision of what you want to contribute, right? Because the top schools are always looking for leaders in the field, right? They're looking for people who are not just going to be great practitioners, but who are going to push the field forward, who are going to innovate, who are going to improve things. And so the best thing that you can do if that's your goal is to find the niche that you want to make that impact in. That doesn't mean that your application has to be like all about cardiology if that's what you're interested in, but thinking about, what you get really excited about and what problems you want to fix and, what improvements you want to make broadly in this field, that will set you up for success rather than thinking I've got to like mimic this past successful applicant and do these things. And it's like this formula. The other thing is really taking opportunities to get to know your mentors, and to take advantage of the great people here who are not only doing amazing work that you get to be a part of, but have impact in the field and can help you grow as a person and be that leader that those medical schools are looking for. So.
Mhm. Yeah, that's great. And having those connections makes such a big difference with anything done, like letters of
Mhm.
recommendation or references. So it's really good to like have an eye on and think about as you're starting your studies here.
Mhm.
Um, okay. I'll also just answer one question about humanities and the writing requirement, just some like clarifying information around that. So, all incoming students take humanities in their first year. And like what Caroline said earlier in the presentation, our humanities sequence would count as part of that English requirement for medical school. So, just by taking humanities, you're already working on this. This can count even in the maroon track, of course, where writing 101 is part of that. Or the gray track. The gray track does not have writing 101 as a requirement, but you could take any other like English course or creative writing course, or you could take all three classes in the humanities sequence in the gray track too. So, what I would recommend is if you have more questions about that or continuing questions and wanting to think through that as well, always you could email your academic advisor if you want to talk through more of that kind of planning side of things. But no matter what, if you're in you'll be in a humanities and autumn quarter, and that's going to set you up just by virtue of, this requirement. Okay, maybe we can do um like just two more questions. Does that sound good? And yeah, we can kind of wrap it up there. So, what was the difference between the Boston track and the Chicago CEW?
Well, the big difference is we don't have planned social events in the treks, right? So you are welcome to socialize, and we encourage you to socialize after our trek day is. But the CW is both social events and kind of employer visits or experiences, and so that's the biggest difference. But in terms of everything else, they're pretty similar. So, right, in Boston, we'll be visiting different faculty and different hospital systems and things like that in a similar way that we'll be doing with the Chicago trek. So yeah.
And then, final question. How common is it for students to take a gap year between undergrad and medical school? Is there like an average of how many years a student might take in between them, or what are some trends you've seen?
Yeah, it's certainly common. Our student, we have students who go straight through. We have students who take gap years. Both cohorts are very successful. Most people who take a gap year will take one or two. But I'm working with a current applicant now who graduated in 2020. So it ranges. But yeah, regardless of it's a matter of when you feel ready and when you feel your application is ready. And so whether that's at the end of your third year to go straight through or with one gap year or two, that's kind of the question. It's not so much like which do medical schools prefer, is like, are you ready? Do you feel good about your application on the timeline that you want? And in that case, that's how you should decide.
Okay, great. Well, those were our questions today. So I'll pass it back over to Lincoln to kind of wrap us up for today.
Awesome. Thank you, both Catherine and Caroline, for sharing that information with us today. Just want to say thank you again to everybody for attending this webinar, as well as all of the webinars throughout the summer. All of them are recorded and available on YouTube, and this one will be available shortly as well. So if there's anything you've missed over the summer, you can go check them out. We have one more webinar coming up next week for families, and it's all about preparing for move-in and orientation week and all of that fun stuff getting here on campus. So you can tune into that one, and we'll see you all on campus in just a few short weeks. Have a good rest of your day.